talk continues on Entertaining Talk Radio, NBC1260 and 96.1 FM. This is Healthy Eyes with Dr. C, live from the Best Buy studios at NBC1260 and 96.1 FM every Saturday from 2 to 3 p.m. For many of us, our eyes are more than just a window to our world. They're part of how people perceive us, how we look, as well as how we see ourselves and others. There's so much more to healthy eyes than just their shape and color. Get in on the conversation. Call 480-423-1260 right now and find out how to keep your world in sharp focus for many years to come. Now, with Healthy Eyes, here's your host, Dr. C.
7 minutes after the hour at NBC 1260 and 96.1 FM. We are live from the Best Buy studios. This is Healthy Eyes with Dr. C, Dr. John Chrisagis. You can get in on the conversation by calling 480-423-1260. Welcome. I was hiding my crummy, dollar store glasses so you wouldn't see the sunglasses I'm using, and hopefully I wouldn't get criticized.
I didn't see them.
Oh, good.
I'll have to take a look at those at the first break.
You saw me messing around with stuff, wondering what that was, and I was cracking up.
After all the conversations we had about sunglasses. Okay.
I bought ones that cost $1. I feel bad about it.
Well, if you want to, we'll go over that show again.
Oh, man, now I got homework. Well, welcome to the show, Dr. C, and tell us who your guest is today.
My guest today is Dr. Lothaire Bluth. Lothaire is an ophthalmologist at Southwestern Eye Center. As a matter of fact, he's the president of Southwestern Eye Center. I can even call him the founder of Southwestern Eye Center. Would that be appropriate?
Yeah, that just makes me feel old.
Yeah, as a matter of fact, they're having their 30th anniversary.
Wow, congratulations.
And when he started his practice, as a matter of fact, I was working in an office in Apache Junction when he opened his first office in Falcon Field. So I've known Lothaire since the beginning, so to speak, and it's been a pleasure to get to know him and watch him build his practice into a very big success. So welcome. Thanks for coming on with us today.
Thanks, John. You look so much younger than I feel.
That's only because we're on radio. But what I wanted to bring Dr. Bluth on to talk about was cataracts. It's something that a lot of people have questions about. A lot of people experience cataracts. A lot of people fear cataracts. And it's one of the things that I think is very misunderstood because it can be something that, it is a surgery. It is an invasive surgery, and it can be very serious, but they've got it down now to such a science that doctors like Lothaire make it almost, they do it with ease, and it's amazing. So we want to talk about that a little bit today so people don't go crazy when they're told by their primary care providers or their optometrists that they've got a cataract and that they're going to need some surgery. So basically, I just wanted to start talking about it and ask you about what age can people start seeing the symptoms of cataracts?
Well, John, as you well know, people can get cataracts at any time in life. Children are even born with cataracts. But most of us get cataracts when we're 50, 60, 70, 80 years old. I tell people that cataracts are part of growing up and that they're basically like gray hair and wrinkles. Yeah. The older we are, the more we're going to show evidence of them.
Exactly. So just away from the context of that, what's the youngest patient you've ever done surgery on for cataracts?
Probably a 1.5-year-old.
Yeah, because you can have congenital cataracts. Right. They're rare, but it can happen. But what are people going to notice when they start getting a cataract?
Well, their vision starts to be blurry. There's three things that people always come to me with when I'm examining. They say, I can't see the street signs until I get up close to them. That's a very common complaint. Second, they say, I see glare and halos around lights at night. And the third thing that always brings them in, they say, I can't see my golf ball down the fairway. So here in Arizona,
something critical to life.
When they tell me that, I don't care if it's their glasses or if they've got cataracts or something. When they tell me that, I just tell them they're hitting the ball too far. Right. They're just too good. If they'd lighten up a little bit, they'd be able to do okay. But they don't take that one too well. But what is a cataract?
Basically a cataract is a cloudiness of the lens of our eye, John. And I always like to explain to patients that our eyes are basically like a camera. There's that little black hole in the middle of our eye. That's the pupil. That's where the light goes in through. That's kind of like the aperture of the camera. Right behind the aperture of our eye, right behind the pupil, there's a lens. The lens of our eye is just like the lens of a camera. It's towards the front of the eye, and then in the back of the eye is what we call the retina, a membrane that's much like the film in the camera. So the lens of your eye is just like the lens of a camera. The retina of your eye is just like the film of the camera. So as the eye goes through the pupil, then it goes through the lens, and the lens refracts or bends the light so that it goes into focus onto the retina. And when the lens has to be clear to let the light go through, just like a camera lens has to be clear. But unfortunately, in we humans and in animals, the lens over time gets cloudy. And the cloudier it is, the less light can get through it. And when it starts to get cloudy, that's what we call a cataract.
Exactly. So when people come into, we always talk about optometrists doing, let's say, 60 to 70% of the primary care eye exams. We see people a lot of times before Lothaire does. As a matter of fact, as Lothaire has built his practice, probably most of his practice is now referrals from other doctors that are sent to him. So he actually sees them when they've already been diagnosed with a cataract most of the time. But,
okay.
When we see them, people are coming in, they don't know, they just figure their glasses are going bad because they're not seeing as well, like it's happened to them numerous times. And what I tell them, the analogy I like to use is that if the window you're looking through is dirty or smudged or distorted, no matter what I do to your glasses, it's not going to get any clearer. And when it gets to the point where we can't make it clear with glasses, there's something else going on. If we see a cataract, we send them to doctors like Lothaire to remove the cataract so they can see better.
Is this something that's absolutely going to happen, or is it something there's a high risk is going to happen? Or
it's like gray hair and wrinkles.
Yes.
If we live long enough, we're all going to get it. And that's what I jokingly say to patients. I say, sooner or later, you're going to be here to see me.
Yeah.
You can see me now, or you can maybe have difficulty seeing me later.
That's right. That's basically what it is. Fortunately, there's many people who are 80 years old who still have wonderful, excellent vision. Almost everyone by the time they're 80 has a cataract. It just may not be interfering with their vision a whole lot.
Yeah.
But, inevitably, it's going to affect you sooner or later.
Is it always consistent across the eye, or can it be just in a particular part of the eye?
Well, that's very interesting, and that's an excellent question because there's actually many types of cataracts. And let me just tell you this little story. The word cataract really means waterfall. Okay?
Wow.
We say people came up with this concept because their vision was getting so bad, and they said, it's kind of like I'm looking through a waterfall. And so they said, well, you must have a cataract, a waterfall in your eye. The word cataract has nothing to do with the visual problem. It's simply a cloudy lens, but the word cataract just has been common usage. But there are many different types of cataracts. You can get nuclear sclerosis cataracts, you can get cortical cataracts, you can get posterior subcapsular cataracts, you can get snowflake cataracts. I mean, the way the lens gets cloudy is different in every person. And so, yes, the answer to your question, yes, there's different ways.
And it's also going to vary. The type of cataract is going to vary when we refer patients to Dr. Bluth, because a cortical cataract typically starts on the outside and moves in, so it's going to affect your vision later than something like a posterior subcapsular that's right in the middle. Nuclear sclerosis, would you say, is probably the most common?
Very much so.
And so that's just going to make a general yellowing or a dimming of the lens itself. And then we also have, not only with aging, but certain medications can bring on cataracts too. And like the long-term use of steroids can cause a posterior subcapsular cataract. And so, you have patients that they'll come to me and they'll say, well, I read online, sometimes online is I hate to hear that word, but I read online where if I take prednisone for my lung condition, I might get a cataract. And well, yeah, that's true, but sometimes you have to weigh the risks and the benefits. And it's okay, you can take your prednisone and breathe and possibly get a cataract, or you can not take your prednisone, not breathe, and possibly get a cataract. So, what do you want to do? And most of the time they understand that they might get a cataract from taking it, but the benefits outweigh the risks.
Interesting. 15 minutes after the hour, you're listening to Healthy Eyes on NBC1260 and 96.1 FM. We are live from the Best Buy studios this Saturday afternoon. Get in on the conversation. If you have any questions about your eyes, cataracts right now is a really good time to call and ask any questions you might have, or you might be concerned. Is this something that your parents have had? Maybe something that you think you might catch, or can you catch it? Or any question you might have, 480-423-1260 is the number to call to get in on the conversation. He's Dr. John Chrisagis, or Dr. C. I'm Executive Producer Mark Shander, and we will be back with more of Healthy Eyes right after this.
Transitions Optical is dedicated to promoting healthy sight worldwide. Transitions lenses do more than correct and protect vision. They enhance the way you see everyday life. By adapting to changing light conditions, they bring out the best in all that you see, so life looks more vivid, more vibrant, more true. Transitions lenses are the #1 photochromic lenses recommended by eye care professionals worldwide. Protect your eyes and learn more about Transitions lenses by visiting your eye doctor or transitions.com.
Come on, Lisa, let's go before it gets dark.
Well, we haven't talked to everybody yet. Why do you want to go so soon?
You know I don't like driving at night. The lights on oncoming traffic and reflections are just awful.
I'll drive back tonight. I have my anti-reflective lenses with me. I don't have that problem.
Works for me. Let's get some more food.
Later that same evening.
Okay, everybody, smile for the camera.
Wait, I need to get my glasses off. They always reflect the light, and I don't like the way they look.
That's it. You're getting anti-reflective lenses, too.
Yahoo!
It's easy to remember to ask for Kodak lenses. The doctors and staff of Tempe Eye Care Associates at 7511 South McClintock Drive in Tempe are committed to providing you state-of-the-art eye care services and products in a comfortable and friendly atmosphere. Remember the Bionic Man? We're not quite there yet, but we're not as far away as you might think. Through annual comprehensive eye examinations, the goal at Tempe Eye Care Associates is to not only maximize your visual performance, but to ensure and maintain your healthy eyes. As part of your annual examination, your visual acuity will be measured and a test known as refraction is conducted to determine your eye's refractive power. Further tests are performed to determine your visual coordination, muscle control, and focusing abilities. Your examination will include a comprehensive evaluation of your eye health to detect diseases such as glaucoma, cataracts, and retina and optic nerve abnormalities. The ocular health evaluation includes neurological assessments, measurement of internal eye pressure, and a thorough examination of the internal and external structures of the eye. Tempe Eye Care Associates also offers the OptoMap Retinal Examination System. OptoMap allows many patients the option to forego dilating drops by providing an ultra-wide view of the retina. While it doesn't replace dilation in all patients, it's an option for many. After performing these tests, their doctors will discuss your results and, if needed, explain your prescription and give you a better understanding of your overall eye health. Traditional options such as glasses, contact lenses, and eye medications will be discussed, as well as any other options you may need to consider. Dr. C is available to assist you personally, so you know you're getting the best available eye care, even if you're not on the Valley's basketball, baseball, hockey, or football teams. You'll see better after you see Dr. C. To make an appointment to visit Dr. C, call his office right now at 480-967-4910. That's 480-967-4910. Help keep your eyes healthy regardless of where you live in the Valley by starting with a call to the office of Dr. C. 480-967-4910 today. 480-967-4910. Or visit www.tempeeyecareassociates.com. That's www.tempeeyecareassociates.com.
Hey Dan, how's it going? Great. Nice looking eyeglasses.
Thanks. They look good, and I can see clearer, too. My doctor recommended these new digital lenses. He said that they're the latest in lens technology. It makes sense. Everything is going digital. There's my ride. See ya.
Bye. Hey, what are those lenses called again?
Kodak. Ask for Kodak lenses.
Kodak, huh? That'll be easy to remember.
It's easy to remember to ask for Kodak lenses.
Transitions Optical is dedicated to promoting healthy sight worldwide. Transitions lenses do more than correct and protect vision. They enhance the way you see everyday life. By adapting to changing light conditions, they bring out the best in all that you see, so life looks more vivid, more vibrant, more true. Transitions lenses are the #1 photochromic lenses recommended by eye care professionals worldwide. Protect your eyes and learn more about Transitions lenses by visiting your eye doctor or transitions.com.
Now, The talk continues, and you're just a phone call away on Entertaining Talk Radio, NBC 1260 and 96.1 FM. Welcome back to Healthy Eyes with Dr. C. Every Saturday from 2 to 3 p.m. Arizona time. Get in on the conversation. Call 480-423-1260 right now and talk about your healthy eyes on the air. Once again, with Healthy Eyes, here is your host, Dr. C.
It's 22 minutes after the hour. We're back talking with Dr. Lothaire Bluth from Southwestern Eye Center on NBC 1260, live from the Best Buy studios. If you want to give us a call, our number is 480-423-1260. That's 480-423-1260. And we're talking about cataracts. And before we continue on with the next part of the conversation, I wanted to ask Dr. Bluth about his thoughts on the formation of a cataract and what actually happens, because we talked about the different types, but there's basically a central theme with how this happens physiologically. Can you delve into that?
Yeah, thanks, John. As we were saying, the lens of your eye is about the size and the shape of an M&M candy. So think of a clear...
Don't mention food in front of him.
I'm getting hungry again.
So just think of a clear little round-shaped piece of material. But inside...
Or a small pepperoni, maybe.
Yeah, well, inside it comes in layers. And again, here's a food analogy, like an onion.
Okay.
It comes in layers like that. And every year you
I'm leaving and getting a pizza.
Right. Every year you get a new layer, just like a tree gets a new ring. So as we get older, the lens gets thicker and thicker and thicker. And that's why, an 80-year-old person can't see as well as a 20-year-old, because there are 60 more layers that the light has to go through.
So with forensics, can they find out how old somebody was by how many layers they had on their eyes, like you could with a tree?
That's a very good question.
I've never heard of that. That's a good question.
But when you're doing the surgery, you actually see these layers in the lens. And I've never tried counting them, but you definitely see the difference in the layers.
That's interesting.
Yeah, he doesn't have time to count them. He's got things to do.
So you talked about surgery, and it's scary to think about going under the knife. Is it still a knife? Is it a laser? And is it something we should still be kind of afraid of? And how's it different now than it had been in the past?
I'll let you take that one.
Yeah, thanks. First, I don't think anyone needs to be afraid of it. Everyone anticipates and is anxious about that. No one wants to have someone whittle on their eyes. I always say that to patients. But when your vision is impacted, then, if you want to lose your driver's license, or if you want to get to the point, people realize that they are going to have to do something sooner or later. Is it dangerous? No, it's an extremely successful operation. It's probably the most frequently performed operation in the United States, even in the world. And the incidence of success is probably 99% or higher. It works great. Patients are very appreciative of it. They're up and around right away. It doesn't take long. But it's done either with a scalpel, or it can be done with laser, although that's still kind of out there. It hasn't been proven to be as effective as the scalpel so far.
Do you do it once, or you do it more than once? Can it come back?
That's a good question. It does not come back. When you take the lens of your eye out, you're
taking it out, and that's the surgery that's performed?
Hey, we'll get there.
You're getting
ahead of us. I'm starting to freak out again.
You basically take the cloudy lens out and put a clean lens in.
You're ruining my outline. You're ruining my flow, Mark. But, in talking about
I have a habit of doing that on these shows.
Dr. Bluth talks about complication rates and things. And what I try and tell patients is that it is an invasive surgery, and it used to be a surgery that wasn't as safe as it is now. But with technology and the skill of the surgeon, they have made it into a great surgery where it's a
great surgery.
No, it really is, where the advantages far outweigh the complication rate. And again, certain people can have complications because it's surgery. You never know what might go wrong, but by far, many more people that have it done have no complications at all, which brings us to the next point, because 30 years ago, when we were both just getting into practice, we were still seeing patients that didn't get the implants that Dr. Bluth's going to talk about in a second. But it used to be you'd go in, you'd have it done, you'd spend a few days in the hospital, you have your head between sandbags so it didn't move, and then you got to come to us to either get fit with a hard contact or a soft contact, or glasses that made your eyes look about this big. And for those of you that aren't on the webcam, that's huge. Glasses that magnified a lot. Well, now when they take the lens out, they're going to put an implant in there, and it's part of the surgery. It's all part of what insurance pays for, so that now you can wear regular glasses or possibly not wear any glasses at all after the surgery. So now what we're going to do is talk about what he does, when he takes out the cataract and removes the lens, which we should probably talk about that first, taking it out.
Okay, and just really quick, you're listening to Healthy Eyes on NBC1260 and 96.1 FM. The webcam is at www.nbc1260.com. So if you want to see what these guys look like, including me, which, again...
Stay on the radio.
Yeah, just listen to the stream. Save yourself from having to see an ophthalmologist. www.nbc1260. If you want to get in on the conversation and you have a question, 480-423-1260 is the number to call. And go ahead. Go ahead and ask.
Taking out the lens.
Yeah. Well, before we get there, let's go back to the risk thing, the complication rate. One of the things that I tell people is, yes, every surgery has risk, just like you said, John. But what I do is I say, look, driving a car has risk too. You could get into a wreck. You could get, an airplane could drop out of the sky and kill you in your car. There's all these things, but what are the chances of that happening? Very, very low. And so we all drive a car all the time. The same with eye surgery. There are risks, but fortunately the complication rate is so very low that I tell people, yes, you probably need to be concerned, but you do not need to fear it because the outcomes are generally excellent. Now, John, let's go back to your question and tell me again what it was.
Well, the patient comes in, they've already decided they're going to have the surgery. They come in that day. What goes on?
The day of the exam or the day of the surgery?
The surgery.
Generally, people come in, they've had a test preliminarily that measures their eye because we have to choose the right lens power to put in their eye. Every eye comes in a different length or a size, from the front to the back. And so we have to choose the lens power that focuses the light onto the retina without having to use glasses, which is another wonderful thing. In many patients, when they have cataract surgery, if they had big, thick glasses beforehand, as you well know, John, many of them end up just having to use reading glasses when it's all over. And amazing. We can even avoid that in some cases. So what we can do for patients is really incredible. But coming back to the day of surgery, when patients come in, they're generally taken back to the operating room. We lay them on a bed. We reassure them that everything's okay. We dilate their eye, the eye that's going to have the surgery, and then we can give them some kind of sedation. And generally, we'll give them a little bit of IV sedation so that they don't have all the great anxiety that most people would have. We anesthetize the eye, and it can either be done with topical drops or it can be done with a small injection underneath the eye.
Sorry.
And then they have the surgery. Of course, we make sure that they never know when we do that, Mark. We give them sedation so that they're in la-la land, and from then on, it's easy.
That's
they love
the best way, I would think.
When they leave surgery, they say, that was so easy. Let's come back and do the other eye next week. So it's come an incredible way in the last 30 years.
Do you do the other eye if it's not necessary? Or when I say necessary, I mean, if there's not a blockage there, but because one eye needed it, that the other eye potentially might, would you do it as a preventative kind of care?
Not generally, because in order to qualify for the insurance to cover your surgery, your vision has to be down to a certain level. Now, some people choose to have the surgery just so that they don't have to wear the glasses. It's kind of like having LASIK surgery, except
so it would be a potential option for a patient if they understand that insurance probably will not cover that.
Absolutely. Interestingly enough, though, most patients if they have a cataract in one eye, they're going to have one in the other eye. So generally, people will get one eye, and then either several weeks later or several months or even years later, they'll have the second eye done.
Do you ever do both eyes at the same time?
In very rare cases when the health of the patient is jeopardized if they were to have to come back for a second time. Yeah. So it's extremely rare, but it can be done.
Because I was going to say, based on your question, it is rare that I ever have a patient have them done at the same time. They'll do one, and if both of them are bad enough, they'll come back and do the other one, like you said, a week later, a month later, a year later, depending. But a lot of times when they come in, they've got them in both. And the funny thing that happens there is they're typically not symmetrical. One's usually worse than the other, so they'll do surgery on the one first. And what I tell them typically at their post-ops is that now the eye that didn't have the surgery, that used to be their good eye, they realize is not as good as they thought they were. They end up having the second eye done sooner than they thought they were because the first eye is now so clear.
I could see going into work during the week and telling my coworkers, I had an implant, and they're going to go, sorry, I don't see it. Yeah, thanks.
Yeah, but as long as you do,
yeah, exactly,
because you will see a lot better. It's 31 minutes after the hour. We're going to take a little break. Again, call us at 480-423-1260. Give us a call. We're talking about cataracts with Dr. Bluth, and we'll be right back.
Transitions Optical is dedicated to promoting healthy sight worldwide. Transitions lenses do more than correct and protect vision. They enhance the way you see everyday life. By adapting to changing light conditions, they bring out the best in all that you see, so life looks more vivid, more vibrant, more true. Transitions lenses are the #1 photochromic lenses recommended by eye care professionals worldwide. Protect your eyes and learn more about Transitions lenses by visiting your eye doctor or transitions.com.
Come on, Lisa, let's go before it gets dark.
Well, we haven't talked to everybody yet. Why do you want to go so soon?
You know I don't like driving at night. The lights on oncoming traffic and reflections are just awful.
I'll drive back tonight. I have my anti-reflective lenses with me. I don't have that problem.
Works for me. Let's get some more food.
Later that same evening,
Okay, everybody, smile for the camera.
Wait, I need to get my glasses off. They always reflect the light, and I don't like the way they look.
That's it. You're getting anti-reflective lenses, too.
Yahoo!
it's easy to remember to ask for Kodak lenses. Hi, I'm Mark Shander, Executive Producer of Healthy Eyes. Every Saturday from 2 to 3 p.m. right here on NBC1260 and 96.1 FM. Your eyes are more than just your window to the world. They're how other people see you and sometimes see right through you. Find out how to protect your vision with the latest technology in eye care this Saturday from 2 to 3 p.m. right here on NBC 1260 and 96.1 FM.
Hey, Dan, how's it going? Great. Nice-looking eyeglasses.
Thanks. They look good, and I can see clearer, too. My doctor recommended these new digital lenses. He said that they're the latest in lens technology. It makes sense. Everything is going digital. There's my ride. See ya.
Bye. Hey, what are those lenses called again?
Kodak. Ask for Kodak lenses.
Kodak, huh? That'll be easy to remember.
It's easy to remember to ask for Kodak lenses.
Transitions Optical is dedicated to promoting healthy sight worldwide. Transitions lenses do more than correct and protect vision. They enhance the way you see everyday life. By adapting to changing light conditions, they bring out the best in all that you see, so life looks more vivid, more vibrant, more true. Transitions lenses are the #1 photochromic lenses recommended by eye care professionals worldwide. Protect your eyes and learn more about Transitions lenses by visiting your eye doctor or transitions.com.
Now the talk continues, and you're just a phone call away on Entertaining Talk Radio, NBC 1260 and 96.1 FM. Welcome back to Healthy Eyes with Dr. C. Every Saturday from 2 to 3 p.m. Arizona time. Get in on the conversation. Call 480-423-1260 right now and talk about your healthy eyes on the air. Once again, with Healthy Eyes, here is your host, Dr. C.
We're live from the Best Buy studios. It's 2:34. I guess I should say 34 minutes after the hour.
Yeah, because on the rerun, people are going to go, this is the middle of the night. He said it's 2:34.
Syndication. We're going to be all over the world anytime now. I know, and they're going to be playing this at various times, so I shouldn't do that. But I'm just learning the industry. We're at 480-423-1260. Give us a call if you have any questions for Dr. Bluth. Dr. Bluth is Lothaire Bluth, the president of Southwestern Eye Center, and he's here talking with us about cataracts. We're having a great conversation. And if you have any questions about family members or yourself as far as cataracts go, or you've been diagnosed with cataracts, you don't know what to do about it, give us a call because you've got one of the experts in the valley here that can answer your questions for you. So we were just talking about, the surgery, and I think we've got them anesthetized. I think we've got them feeling pretty good. You mentioned La La Land. Mm-hmm. What are you going to do now?
Well, once they're sedated, once the eye is anesthetized, then we roll them into the operating room, and they're laying on a bed, or sometimes they just sit on a chair and lay the chair back. And then we use an operating microscope that magnifies the eye about 15 times. So the surgeon's actually looking through a microscope while he's doing the surgery. The eye looks about the size of a beach ball, so you can see all the details extremely clearly. We use either a scalpel or a laser to make a little incision that's only a 1/16 of an inch wide.
Wow.
And we go inside the eye, and then the cataract itself has a sac around it called the capsule. So we tear a large opening about the size of an eraser on a pencil in the capsule and then go inside and take all the cloudy layers out. I tell people, going back to the M&M analogy, it's like taking an M&M candy and taking the chocolate out of the M&M candy, but leaving the...
Don't go there, Mark. Don't go there.
I'm drooling over the eye surgery. I never thought.
Once you get all those inside cloudy layers out, and remember, that's the tree rings that we were talking about, then it leaves this clear little sac. And then you take a clear lens and you choose the right power for the patient depending upon the length of their eye, and you roll it up like a carpet. So you can get it in through this little tiny incision, and then it unfolds inside the eye, inside the little sac where the cataract was. I tell people it's kind of like putting a ship in a bottle. Okay?
Wow.
Because you get this 12.5 millimeter piece of plastic inside an eye through an incision that's only 1/16 of an inch wide. It is incredible. I've been doing it for 30 years.
That is talent to be able to do that.
Well, it takes a lot of practice.
But that's why I say the talent of the surgeons is amazing nowadays, and the technology to be able to make a lens like that you put in there is amazing. Pharmacologically, between the drops we have for postoperative care with the antibiotics and the steroids and everything else, that's what makes this surgery so great. It's a combination of all those things. But now they'll do that surgery now, and there's no sutures after surgery. You don't have any stitches in your eye or anything because the incision's so small, and it's just amazing to watch and to see patients afterwards compared to what it used to be like.
And John, let me just go. The one thing that I didn't mention is the way we take the cataract out, because remember, it's the size of an M&M candy, and it's relatively solid. The younger a person is, the softer the material is. The older we get, the harder. And I tell sometimes it's literally as hard as a raw carrot. It's that hard. But in younger people, it's kind of like soft butter. So depending upon the stage of the cataract, it takes either a lot of, and you can't take it out in one big piece because the incision is so small. So there's an instrument that we call the phacoemulsifier that's basically like a little miniature jackhammer that breaks it up into little tiny pieces. So we turn the cataract into mush and then just suck it out through a little tube. How we get it out through the little tiny incision.
It's amazing.
Yeah, it's remarkable.
That is really interesting.
Yeah.
So you're done with that. You're finished. I mean, I've had patients tell me that he talks to them while he's doing surgery.
Seriously.
Yeah.
I mean, you have people that
they're awake. They know what's going on, and they're relaxed because of the sedation you give them. But it makes it because it can be very anxiety producing. I think as we speak to the patients and let them know what's going on, it really reduces their anxiety and it makes them feel very comfortable, makes them feel involved, and they kind of know what's going on so they don't have to worry about things.
That's interesting. So if you don't mind me asking, what about pain afterwards? It sounds like because somebody has actually cut into your eye, that, and I understand it's a very small incision. It's on the list.
You're doing great. That's the first question you've ever asked. It's on my list.
Well, first of all, there's no pain during the surgery. And second of all, it's just like when you go to the dentist and you have your jaw anesthetized. It's going to last 6 to 8 hours after the surgery. It'll be anesthetized. And the outer layer of the eye heals very, very quickly. So within 24 hours, it's usually healed over. And, John, I rarely have patients complain of pain.
No, rare.
It's very rare.
Yeah. And a lot of times if there is pain, it's from something else.
Yeah.
It wasn't from the surgery itself.
Right.
Wow.
Sometimes you'll scratch the surface of the eye while you're doing the surgery, putting the lid speculum in. By the way, that's another question people ask. How can I keep my eye open while you're doing surgery? And we say, we put a little instrument in to hold the eyelids apart so they don't have to worry about that. But
maybe I'll try one on you next week.
Oh, man.
I don't know, Mark. You may think you're ready to do this.
I might go through it just to kind of see what sit down, kind of describe what's happening. And, we thought about doing that. We thought about actually having a patient in, because a lot of people who are listening, believe it or not, have never gone in for an eye exam for the first time at all. And they're just like, well, in school we did the little thing where we were grabbing the fly or the butterfly, depending on how good their memory is. Mm-hmm. And they remember grabbing the wings of some insect. And they had a couple of things that they went through the color blindness test. They went through a lot of things, but they haven't done anything since then because they haven't had any problems. So they haven't gone through any kind of preventative preventive care, if you will.
Yeah, and, it's interesting, John, I'm sure you've talked about this on the show before, but people 65 and older spend 90% of the healthcare dollars regarding their eyes and vision. So, if you're 65 and younger or 40 and younger, then chances are you're not going to have problems. But as we get older, unfortunately, everything kind of wears down. So.
Yeah, we talked about that with macular degeneration and everything else. Yeah. As we get older and things go wrong with the eyes, that's when we start doing the whether it's glaucoma, cataracts, macular degeneration, things like that. So that's where the show comes in handy and lets people know that some of these things they need to be very concerned about and try and do what they can to prevent them, and others don't worry about it, because not anything you can really do to prevent a cataract anyway, contrary to popular belief, except maybe wear your sunglasses if UV is going to be part of the source. But a lot of cataracts just happen to be aging and genetics, and maybe if we think about it, the toxins that are in our diet and in the water, I guess you could think that might have something to do with it too. But most of the time, there's not much we can do to keep those from coming around. Mm-hmm. But I guess the last question I'll ask as far as the whole surgical process goes is, how long will I be away from what I like to do? How long do I have to stay out of work or not golf or do anything?
Well, the rest of the story is that when we finish the surgery, we put a little bit of antibiotic, either drops or ointment on your eye, and we put a little shield, a little protective shield over the eye, and we tape it there so you don't reach up and hit your eye while you're sleeping at night. The next morning you come back, we take the shield off, check the eye, make sure everything's okay, make sure your vision's appropriate for the first day after surgery, and then we tell you to go ahead and go back to your regular activities. But we say, don't reach up and rub or bump your eye. Don't lift heavy objects, anything that would make you really put a lot of strain, like if you were trying to squat down and lift 100 pounds, that wouldn't be very wise. But the fact of the matter is that people can get almost back to their regular activities the next day, including driving. Yeah,
that's the amazing thing, that the downtime is virtually nil.
Yeah. So do they kind of talk like a pirate for a while and kind of maximum?
They always ask for a black patch. We give them a white patch, and they think they're the good guys.
Yeah. There's not a.
Now I have to buy a parrot.
Yeah, the white patch it's not good for the image.
Right.
Play Jack Sparrow. So basically we've. Is there anything else you wanted to mention about the surgery itself or the whole process before we go on to?
And the fear. I mean, you're starting to alleviate a lot of fear. Do people generally have the fear and come in, and your first job, I guess, is kind of disarming or disalarming them from the fear?
Well, one of the great fears that people have is when they start to lose their vision. If you have perfect vision and then all of a sudden you can't see things that you wanted to see, that's very concerning. And then they tell you have to have surgery. Well, that's even more concerning. And so, yes, sometimes I'll walk into an exam room, and I'm sure John's had this happen too, where people are just so nervous that they can't even sit down on the chair to be examined. And so it does take a lot of helping them understand what the issue is. But when patients understand what the problem is, what you can do to help them, and what the risks are, then they accept it. They may not want to do it, but, it's better than losing their vision.
And did you want to go?
No, go ahead. Well, I was just going to kick it off, but if you want to kick it off in a moment.
No, you can go ahead and do that, and then I'll take off on what I was going to mention after the break.
Okay, what is it? We'll tease it just before we go to the break.
Well, I was going to talk about what Dr. Bluth does, at least to the patients I send him, to make them feel more at ease.
I'm looking forward to hearing that.
It's great.
Okay. 15 minutes till the top of the hour at NBC 1260 and 96.1 FM. You're listening to Healthy Eyes with Dr. C. We are live from the Best Buy studios. Get in on the conversation. Ask your question about eye care at 480-423-1260. That number again is 480-423-1260. And we will be back with more of Healthy Eyes with Dr. C right after this.
Transitions Optical is dedicated to promoting healthy sight worldwide. Transitions lenses do more than correct and protect vision. They enhance the way you see everyday life. By adapting to changing light conditions, they bring out the best in all that you see, so life looks more vivid, more vibrant, more true. Transitions lenses are the #1 photochromic lenses recommended by eye care professionals worldwide. Protect your eyes and learn more about Transitions lenses by visiting your eye doctor or transitions.com.
Come on, Lisa, let's go before it gets dark.
Well, we haven't talked to everybody yet. Why do you want to go so soon?
You know I don't like driving at night. The lights on oncoming traffic and reflections are just awful.
I'll drive back tonight. I have my anti-reflective lenses with me. I don't have that problem.
Works for me. Let's get some more food.
Later that same evening.
Okay, everybody, smile for the camera.
Wait, I need to get my glasses off. They always reflect the light, and I don't like the way they look.
That's it. You're getting anti-reflective lenses, too.
Yahoo!
It's easy to remember to ask for Kodak lenses.
Hey, Dan, how's it going? Great. Nice-looking eyeglasses.
Thanks. They look good, and I can see clearer, too. My doctor recommended these new digital lenses. He said that they're the latest in lens technology. It makes sense. Everything is going digital. There's my ride. See ya.
Bye. Hey, what are those lenses called again?
Kodak. Ask for Kodak lenses.
Kodak, huh? That'll be easy to remember.
It's easy to remember to ask for Kodak lenses.
Transitions Optical is dedicated to promoting healthy sight worldwide. Transitions lenses do more than correct and protect vision. They enhance the way you see everyday life. By adapting to changing light conditions, they bring out the best in all that you see, so life looks more vivid, more vibrant, more true. Transitions lenses are the #1 photochromic lenses recommended by eye care professionals worldwide. Protect your eyes and learn more about Transitions lenses by visiting your eye doctor or transitions.com.
Now the talk continues, and you're just a phone call away on Entertaining Talk Radio, NBC 1260 and 96.1 FM. Welcome back to Healthy Eyes with Dr. C. Every Saturday from 2 to 3 p.m. Arizona time. Get in on the conversation. Call 480-423-1260 right now and talk about your healthy eyes on the air. Once again, with Healthy Eyes, here is your host, Dr. C.
48 minutes after the hour. See, I remembered that time.
That's great.
And we're live from the Best Buy studios on NBC 1260. Our phone number is 480-423-1260. Give us a call if you have any questions. You got about 10 minutes to get a free consultation here with Dr. Bluth from Southwestern Eye Center. Before we go today, I'll be sure and give you the contact information for Dr. Bluth and how you can get a hold of him. But we just finished talking about cataract surgery and what actually happens and what we can expect from it. But one of the points I wanted to make is that wherever you happen to go for the surgery, obviously the skill of the surgeon is very important. And there are a lot of great surgeons here in the Valley because we tend to have a population that is a little bit older. And as we all get older, like you said, we're probably all going to get cataracts at some point in time. So there's a lot of cataract surgeons around. But just what I wanted to say was, in the way he's talking to us today is the way he talks to people in the OR too.
Seriously,
and he's very down to earth, very calming. I've never had a patient complain about him, and I've sent a lot of patients to him for cataract surgery, and that's the reason why, because he does put them at ease. They're very calm when they're having it done, and they come out of it, feeling a lot better about their vision, but then also about the whole process. So that's, kudos to you for being able to do that and keep patients.
It's the radio voice, Mark. Careful, I'm gunning for your job, Nick.
Oh my!
yeah. So because some surgeons get a bad rap for being.
We should switch for a day and see how the patients feel.
No. Okay.
Wait a minute. Let me know when that day.
Let me know when that day is going to be.
That's going to be the day you're not going to refer.
Oh yeah, no referrals that day. But that's the whole thing. When you've been around, like I say, as long as Dr. Bluth has, and I say that in a nice way, but when you've been around as long as we have, and you build a reputation with referring doctors, a lot of, he gets a lot of referrals.
I had a really cool idea. Let's do this. Not this particular show, but when we have a guest with a particular talent like that again, let's get the operation game, and let's put it on the table, and we'll see if I get eliminated first. I think it would just be I would get eliminated first. There would be no way I could keep up with you guys. But
well, you could probably keep up with me pretty well, because I always say I faint
How fun would that be?
I faint when I cut myself shaving, which is why I went into optometry, because I don't have to worry about that kind of stuff.
Cool.
So,
do you play the game? I mean,
yes, of course.
Do you just rock at it and
when I use the operating microscope, I'm great with it.
Yeah. That's how he practices at home.
Right.
Okay. Well, you're listening to Healthy Eyes on NBC 1260 and 96.1 FM, the flagship of syndication coming up. We are live from the Best Buy studios. You can get in on the conversation at 480-423-1260. And Mimi from Phoenix called 480-423-1260 to get in on the show. And welcome to the show, Mimi.
Oh, thank you. Oh, this is great because I have had this question in my mind for so long. I wear readers. Now, I'm 65, and I've not gone to have my eyes checked. I'm thinking, a lot, several, 8, 9, maybe 10 years ago, because I had prescription glasses. So I've been wearing readers, or maybe it was even more than 10, but anyway, it's been about that. And a friend of mine said that she'd gone to her eye doctor, and that he said that readers were okay, even if you do wear prescription glasses, that it wouldn't do anything to the eye to change it or hurt it in any way or anything. And I'm just curious to see what you would have to say about that.
Well, I'll start off. My first comment will be shame on you.
And that's
for not having an eye exam for so long, but that's okay.
That's Dr. C and his primary.
But as far as
eye care physician,
as readers go, if your prescription just requires magnification, wearing readers, I think, is okay. But as we've talked about on certain other shows, the problem I have with someone who's 65 and just using readers, not having their eyes examined, there are too many other things that can be going wrong with your eyes where you still see well, maybe not 20/20, but 20/25, 20/30, definitely okay to get around with, and you think everything's okay. The main problem with just going and buying readers is there could be other things going on in your eye. Let's say glaucoma. Glaucoma's the example.
Or dry or wet macular degeneration, wouldn't you say?
Well, wet she'd know about.
Look at this. I'm not an eye doctor, but I play one on the radio.
But dry in the early stages, she wouldn't know she had it. But so, Mimi, the point I'm trying to make is you don't necessarily have to go in every year and have an exam, because it sounds like you're doing very well at 65 if all you're doing is wearing readers. But you should go in every once in a while to make sure the health of your eyes is still okay. And if it turns out that all you do need is magnification, well, hopefully that doctor will say, yeah, you can get a pair made direct exactly for you with the centers of the lenses where they need to be and good quality ophthalmic lens. But if all you need is magnification, sometimes I'll send you out to buy those things too.
Okay, that's great, and I agree with you. I've waited way too long, and I know I need to do this now. Would I go for an exam with an ophthalmologist or an optometrist?
Oh, the age-old question.
Yes.
Now, I'll answer it, and then I'll let Dr. Bluth answer. But what I typically say is if you're doing okay and you just need to see if you can see better, I say go to an optometrist. We are quote-unquote eye specialists, vision specialists, where I consider ophthalmologists eye specialists. And if we think you have anything that needs secondary or tertiary care, we're going to send you to the ophthalmologist to go from there. And okay. I'll let Dr. Bluth expound on that if he wants. But
I agree 100% with that, John. If you're going to see an ophthalmologist, then you've generally got some health problem with your eye, or you need some kind of surgical intervention. 80% or more of the general eye care in the country is done by optometrists. Most of them are extremely well trained and very, very competent. And
except me, of course.
Actually,
and
you've got the digital stuff.
You'll be very satisfied in going there. If you feel uncomfortable and feel like the testing hasn't been adequate, there's other optometrists who are very competent, or if you want to, you can see an ophthalmologist. But ophthalmologists, unfortunately, there's less and less of them being trained nowadays, and so more and more of them are just seeing patients on a referral basis.
And okay. Mimi, what area of the valley do you live in?
I live in Mesa.
Oh, okay. So not too far away from Dr. C's office. And if you'd like to see the guy who's actually on the radio, Dr. C, how would Mimi get a hold of you?
Well, you could call us at 480-967-4910, or the website's www.tempeeyecareassociates.com, or if you don't like to type, www.drsee.com.
Dr. C.
Yeah.
Oh, how do you spell your name?
John.
No, your last name.
No, Chrisagis.
Oh, okay, I get it. That's why you go by Dr. C.
There you go.
So much easier.
Yeah.
Would you please give me that phone number again? 480-967-4910. 4190. And I just tuned in. So you are an optometrist then?
I am.
Oh, great. Okay. I certainly appreciate the information, and I will follow up on it.
Thanks for calling.
You bet. Thank you.
She was asking just all the right questions.
Yeah, there goes Mimi.
Mimi.
I do not know Mimi. Mimi, thank you very much for calling. Seriously. 480-423-1260 is the number to call. There goes Mimi. She called 480-423-1260. You're listening to Healthy Eyes on NBC 1260 and 96.1 FM. We are live every Saturday from the Best Buy studios at 2 o'clock in the afternoon.
And I wanted to talk a little bit about how to contact Dr. Bluth and Southwestern Eye Center. They have offices all over the state, as a matter of fact.
Oh, okay.
And a few here in the Valley, but they're all over the state. As a matter of fact, when he first started out, I think he was flying everywhere.
Wow.
You'll do most anything to see patients in the beginning.
To take care of people.
And if he was flying to Safford, and you were going to, I mean, I know you were going to Coolidge, but you drove there. But where else did you fly to?
Yuma.
Okay.
And it's kind of spread out all over the place. You know, that's a kind of an interesting story. You know, the story of being out at Falcon Field on the airport in Mesa. That's kind of what led us to that to start with. But it's been a real privilege to be able to help people throughout the state. Yeah,
the first office was at Falcon Field, and when I think all that was out there then was orange groves.
That's about it. Yeah, it was.
And now it's surrounded by development. But the main number to call for Southwestern Eye Center is 480-854-8185, and they have a lot of doctors on staff that can help you with any vision need you may have. But Dr. Bluth is just one of them, and I'll call him the main one since he's the president. They might not agree, but in this room we do. But that's how
Absolutely.
You can contact him if you have any questions at all.
What's the primary question that you get from people about eye surgery at all? And do you do more than just cataracts?
I'm primarily just cataract surgeons, but we have retinal surgeons, we have glaucoma surgeons, we have oculoplastic surgeons, we have pediatric surgeons. Anyway, there's just the whole gamut. So I don't know that there's any. The general question I get is it going to hurt?
Okay. Yeah. Well, it sounds like it doesn't, and it's something that we shouldn't be afraid of. Same thing about seeing an eye care specialist for the first time.
Well, like,
or if you haven't seen one for a while.
Well, you were asking about, why should you be afraid of dilation and everything else, and we talked about how that if you don't know what's going to happen, you have the fear factor is a little bit higher, a little more anxiety because a fear of the unknown. Where the more you know. And hopefully Dr. Bluth was able to talk a little bit about it in a layman's terms to let you know that it is surgery, but it's done thousands of times a day, and it's very well done, very well.
Dr. C, give us your contact information again as well.
The phone number is 480. If you didn't hear it from Mimi enough times, 480-967-4910, and the website is www.drsee.com.
Or Tempe Eye Care Associates.com.
Yeah.
Okay. And then what are some of the other things that people should be aware of when they're, the flashers and those sort of things that are kind of indicators of go get it taken a look, go get it looked at, just to make sure it's not
you're not going to get anything like that with a cataract. The cataract is basically just a blurring of the vision where you're not seeing as well as you have in the past. But anytime you get the flashes and floaters, it's you should have it looked at because most of the time, it's probably going to be something we're going to tell you not to worry about, but you don't want it to be that one time in 10 that it might be a retinal tear, retinal detachment, or something like that. So it's worth at least talking to a doctor's office about.
Are those things you see as well and take care of it?
Yes. We have plenty of staff people that do those evaluations.
Okay, and we will see you next week on Healthy Eyes. Thanks again for tuning in, and we'll see you next week.
You've been listening to Healthy Eyes with Dr. C every Saturday from 2 to 3 p.m. Arizona time on Entertaining Talk Radio, NBC1260 at 96.1 FM. The opinions expressed on this show are those of the host and are not meant to diagnose or treat any particular medical issue. Always check with your doctor or eye care professional before making any changes to your vision care. For more information about Healthy Eyes or to learn how you could be a guest on the show or a sponsor of the program, visit Dr. C at www.drsee.com.
NBC 1260 is KBSZ, Apache Junction. Also operates on translator K241BQ at 96.1 FM.